Welcome to a very special episode of Mind Matters. We all know as seasons change, so can our mental health. So today we're delving into the topic of seasonal depression, also known as seasonal affective disorder. We're going to shed light on its nuances and coping strategies. And joining us on this very special episode is a special guest, Dr. Gathoni Kamau, a seasoned mental health expert who will bring a wealth of knowledge on how we will navigate these challenging feelings. Dr. Gathoni is a specialty and associate specialist doctor in neuropsychiatric with nearly 10 years of clinical experience in psychiatry and neuropsychiatry. She is particularly interested in the interplay between physical health conditions and dementia, and she's very passionate about reducing pharmacological treatments for patients with neurodegenerative conditions and promoting of social prescribing. So today we will explore insights, share coping strategies, and provide a beacon of support for anyone grappling with the impact of seasonal changes on their well-being.
Thank you, Dr. Kamau. So we wanted to start off with first knowing what seasonal depression is, because there's different depression out there, and we wanted to find out what this one is in particular and what causes it.
Yeah, thanks, ladies, for having me. I'm a avid listener and a fan, so it's really cool being here on your podcast. Yeah, that's a really good question. So, what is seasonal affective depression, or SAD, as we call it? So, just from the title, we can tell that it's depression that's caused by the seasons. So we know it's a mental health condition and it's triggered by the changing of the seasons. So it's a subtype of depression, and it's basically when the seasons change, so we see it even with animals. You see bears in the winter, they hibernate, they go and stay in a cave, and then they come back out in the summer. So seasonal affective depression is no different than normal depression in terms of the symptoms, but the causes might be a little bit different. When you have seasonal affective depression, some people call it winter depression because symptoms are more apparent or more severe in the winter, but there's a subset of people that they may also have symptoms in the summer. So it is affected by the weather. So for example, you have a persistent low mood, loss of pleasure or interest in normal everyday activities, you're more irritable, feelings of despair, guilt, worthlessness, feeling lethargic, lacking energy, very, very sleepy during the day, or sleeping for longer than normal and finding it hard to get up in the morning, craving carbohydrates, craving food, gaining weight, difficulty concentrating, and a dip in your libido. Yeah. So, and from what we know, some of the causes, so we know that I'm going to get a little bit technical. So
that's okay.
Allow me to geek out. So we know that we have melatonin, so not to be confused with melanin, which is what is making us all pop this morning. Yeah. So melatonin is a hormone that makes you sleepy. It's involved in sleeping. In people with seasonal affective depression, your body may produce it in higher than normal levels. So we don't know much about it from research, but it's the hormone that your brain produces in response to darkness. So if you think about us here in the UK, dark in the winter is dark a lot, I mean, it's getting dark from 4:00. So and this hormone sort of, you have your own internal body clock, which we call your circadian rhythm. which
Okay.
uses sunlight to
Yeah.
do, your body has its own clock, has its own rhythm. So if you imagine in the winter, you have very little, the time is different. You have few hours of light and long hours of darkness.
Mm.
So it puts your body in a tizzy. Yeah. So even though it's not essential for sleeping, but say this melatonin, you sleep better when you have the highest levels of it in your body. So that's one. The second one would be we have a hormone called serotonin, and this affects your mood, appetite, and again sleep. And lack of sunlight can lower your serotonin levels. And serotonin is linked to feelings of depression, anxiety, and we know that serotonin is really important, as I've said, in mood, sleep, digestion, feeling unwell, wound healing, bone health, blood clotting, libido, sexual desire. And it's interesting to note that only about 10% of serotonin is found in your brain. A lot of it is made in your gut.
Wow.
So this links more. We'll talk about this more when we talk about diet, food.
Okay.
You are what you eat.
Literally.
Yeah,
Absolutely. I'm glad you said that.
and finally, as I've already mentioned, your body has its own clock.
Yeah.
We were made, the body is a fascinating thing. It has its own internal clock. So clinically, we call it your circadian rhythm. So this is when your body uses sunlight to time various important functions, such as when you wake up. So lower light levels during the winter will disrupt this clock because it's being sort of deceived by what it's seeing. And that's why also in some countries where there's long summer months, long light, your body gets confused. So these circadian rhythms are sort of physical and mental and behavioral changes in your body that follow a 24-hour cycle. So one important one is your sleep-wake cycle. And these are natural processes that respond primarily to light and darkness. So does that make sense?
Yeah.
Yes.
That
Yes,
is
definitely.
That is actually a really good explanation of what seasonal depression is, because it's one of those things, a lot of people go through, but you don't know, is this really it, or like what is going on with me? And I'm glad you've sort of mentioned the fact that it happens mainly in the winter, and the explanation for that. But Dr. Gathoni, how can one distinguish between typical winter blues and, say, clinically significant seasonal depression? Like, how would anyone know, okay, actually, this is something that might be a little bit more than what I just think it is, like just feeling low and down?
Yeah. So as I said, even though we are calling it seasonal affective depression, it's still depression. And as with any kind of mental health, if it's lasting longer than normal, if it's interfering with your life, so even with general depression, if you're not able to get out of bed, you're not able to do the things you normally do, you're having thoughts, intrusive thoughts, feelings of hurting or harming yourself, then that, and it's lasting for a long period. But as we know, winter feels very long. So I would say, for me myself, I do feel a dip. For myself personally, I do feel a dip when the clocks go back and the long
The longer
the long
days
nights,
and
the darkness. I do feel a dip in myself. So I would say it's being able to recognize that there's something something is amiss and being able to ask for help. But again, it's when your symptoms, as all those symptoms that I've explained, when they become quite debilitating. But it's not much different than, it is a kind of depression. So, we can split hairs, but it is a form of depression. So it's difficult to really distinguish between the two. But if it's getting worse and worse and it's not working, it would be really important to seek help.
Okay. So Dr. Kamau, there's some myths out there that seasonal depression isn't treatable. But with the way you've explained how seasonal depression is and how it's caused, do we need medication to treat it? Like, how do we manage it?
So that's a really good question. Yes, because you've seen that sometimes it's light, that it's this issue of not having enough light. So you can treat it with sad lights or light therapy. There are these special lamps or a light box. And this is a really popular treatment. So remember, this is treatment. It's prescribed. Because I think sometimes we think that treatment is just medicine, like you take a tablet.
Yes,
that's it. Yeah.
But there's lots of things that, as a doctor, we don't just prescribe you medication and go. So it's good to think of a treatment broader. So yes, you can use medication. So you guys are pharmacists, so we use SSRI, the antidepressant, because it's a serotonin issue. So SSRI is what is used. So that is one type of therapy, but that would be between you and your doctor to judge, depending on your symptoms. Yeah. So we can use SSRI. So that's pharmacological interventions. We have light therapy. So you can get. I'm sure you've seen around, people buy these lamps to put on them. Yeah, so it's that, trying to sort of regulate your clock and expose you to light and get all those things going. You can also have talking therapies, so like counseling. Yeah, because depression, at the end of the day, it's still depression.
Yes.
Yeah. So, and we have, we have cognitive behavioral therapy. So it's a kind of talk therapy. So this kind of talk therapy helps you manage your problems by changing the way you think and behave. And counseling helps you look at your experiences of distress, and helps you see it from your perspective and how it's impacting you internally. So it may seem the same, but they're slightly different. But there's many different types of talk therapies that you can do. And also lifestyle. There are certain things that you can do to help yourself, which are like treatment. So we say try get as much natural sunlight as possible. So for a lot of people, we work indoors. So you wake up in the morning, it's dark in the winter.
Yeah.
You wake up, it's dark. You go to work. So you guys are pharmacists. I'm assuming you're sitting in the back where there's no windows, right? There's nothing. When you finish work, in my mind, you guys are sitting in the back in a room where there's no windows. Yeah.
Literally, yes.
Yeah.
Secret agents we are.
Yeah, and then when you're coming back home in the evening, it's dark again.
It's dark.
And the only
100%.
and the only time you're going to see light is on the weekend. And
almost never, because if you're working say 6 days a week.
Exactly. And then if it's raining,
Yeah.
you open the curtain and you're like, yuck, you close it and go back to bed.
That's it. Do you know
Yeah.
what? I'll raise my hand to this one. I say, yeah, 100%.
Yeah. So it's, so I would say, try and get as much natural sunlight as possible, So
Yeah.
even a brief walk at lunchtime can be really beneficial. Just get exposed to the light,
Yeah.
Another thing you can do is make your work and home environments as light as possible with as much air as possible. Because again, you're trying to help your natural body clock to do what it's supposed to do. And you can also sit near windows when you're indoors because you're exposed to light. And then take exercise, especially try to do things that are outdoors in daylight. Yeah. And then again, eat what you are what you eat.
You are what you eat.
And also if you are feeling like you're feeling like you're just not feeling okay, it's good to talk. As they say, a problem shared is a problem halved.
That's right.
Yeah. So
that is good. That is good information. And you did touch on the whole, when it comes to medication, SSRIs, which is something we see a lot of in pharmacies. But what you've also said is sort of consultation with a healthcare provider is crucial, just to determine what is the most appropriate treatment, whether it's actually medication or maybe some of these modifiable factors that we could sort of implement. So that's great to know. But what you've also touched on just very briefly is diet. So is there any sort of specific nutritional considerations or dietary changes that might impact seasonal depression? And if so, how would diet contribute to overall mental health? Let's not downplay that mental health is actually a big issue. So how would diet contribute to overall mental health as well?
Okay, thank you. So let me just, it's something I forgot to mention with the SSRIs, is that, it takes time. So it takes like 4 to 6 weeks for it to take full effect. So it's not like you just start taking it and then it will start working. And another thing that we see a lot in clinic is because it takes time. So people have taken it for a week and they're like, oh, it's not working, or 2 weeks or a month, and then they stop taking it abruptly. So my advice would be always take medicine as prescribed. And always follow your doctor's order. So never stop things abruptly, especially your antidepressant, and never stop things without medical advice. And we know with the medications, they have some quite common side effects. So you can, when you start taking them in the beginning times, you're feeling more agitated, shaky, anxious, your stomach, you might have loose stools or get constipated. But after a few weeks, these symptoms should improve. Because remember, we said about serotonin is involved with a lot of things in your body.
Yeah,
that's right.
Yeah. So you have to, and then you also have to be cognizant of other medications that you're taking. So I would say when prescribed medication, always follow your healthcare provider's advice, and don't just stop, because you find a lot of people just stopping, and that makes you worse. So PSA, please listen to your healthcare provider. Yeah. So in terms of diet, this we can talk about forever. So I disclaim I'm not a nutritionist, but from what I gather from research, there's no one specific diet that is best. But what people say is that it's balanced. That is the key, is a balanced diet. Not, you're doing keto or you're doing, I don't know, intermittent fasting. Not that I'm talking badly about these things, but it needs to be
A
balanced. And
balanced, yeah.
we
Yeah.
know ourselves as women, we do fads. So it's after
Yes.
Christmas, you're like, I've eaten too much, so I need to do X, Y, and Z. And, we do things
Mm.
in trends.
Hmm.
And, so from the research that's out there, in terms of what you eat, it needs to be balanced.
Yeah.
And
Okay.
it needs to be something that you can sustain. It's a lifestyle choice. What you eat is part
Mm.
of your lifestyle,
Yeah.
you know. So the key important things in terms of diet and your mental health is that the advice from the British Association of British Dietitians is that you should eat regularly
Hmm.
throughout the day, because food is energy for your brain.
It is.
Mm.
It's energy for your body.
It
So,
is.
balance healthy,
Mm.
diet with fats, because you do need fat to maintain, cell structure of your brain. So
Yeah.
oily fish, unsaturated fats,
Hmm.
vegetables, whole
Yeah.
grains, pulses, beans, lentils. Drink lots of fluid. And when we say balance, we mean your food should include starchy carbohydrates, protein,
Mm.
vegetables, salad. Remember what you learned in school,
Yes.
in your yes.
Yeah. That's it.
Yeah. Because there's we're all different. We all come from different parts of the world.
Yeah.
Yeah.
I think, just my own opinion, sometimes maybe going back to what we are supposed to be eating.
Hmm.
You know, but yeah, so in terms of diet, it's really important. Another thing is sort of vitamin D.
Okay.
So we know that vitamin D, like having low levels of vitamin D, can also make you have symptoms of depression and anxiety.
Yeah.
Mm.
So normally you can get your vitamin D. So from here in the UK, March, early April to the end of September, you should be able to
Hmm.
make all the vitamin D that you need from sunlight.
Okay. Fantastic. So as you've mentioned, like diet plays an important role in our health and is quite important for patients to keep their food balance basically and make sure you're getting all your nutritional supplements, yeah, to help you make it balance. I think that's quite important. And Dr. Kamal, so there are people out there who think seasonal depression is just like unique to women. But then I was just thinking men just usually don't tell us how they feel, to be honest. So even if they had like seasonal depression, they wouldn't really say like what is going on with them. But how common is it? Like, is it common in men or is it common in women?
So I think it's different to differentiate between the genders when it comes to, because remember, SAD is depression. So I think we would be, or I would be amiss in saying that, yeah, women get it more than men. And
That
Okay,
makes
that's
sense.
interesting.
Yeah.
yeah.
How about though, like with things like hormonal changes and hormonal factors and things like that? Do you think that, I don't know, I feel like sometimes women, it's just the way we are built. There's things like hormonal factors to look into, even things like social cultural factors, how like we kind of juggle life, multiple roles, things like that.
Mm.
I would almost think that women would um experience seasonal depression even more, because there is
Yeah.
sort of times, I mean, and I say it from just being, I suppose, being a woman, like with say
Yeah.
hormonal factors, right? So
Yeah.
there is that time where, say, during a menstrual cycle, I suppose reproductive phases,
Yeah.
these can somehow just affect your mood. And I feel with other
Yeah.
factors on top of that, during this season where, you know, already there's a whole circadian rhythm and all of that, I feel like as a woman, I would think that you almost have more factors that are contributing to possibly having a high prevalence of seasonal depression than a man. I don't know if I am correct
I
in
mean,
thinking that.
yeah, I've never been a man, but I think also men go through it, you know. I think,
Yeah.
you know, it's for as women, we know our struggles, especially as women of color, we know our struggles, you know. There's lots of struggles, there's lots of cultural expectations that are put on us, and you're carrying all this
Yeah.
weight of expectation on you. You have to be a good girl,
Yeah.
but then you know, you have to be a good girl, you have to study hard, then you through school, then you grow up, and then everyone's asking you, where's your husband? You know, when are you having children? There's a
Kids.
lot of
Yeah.
expectations
Oh,
that,
yes.
you know, and then on top of that, we have our hormones, which are just running havoc, you know. So you
Yeah.
have PMS, you have cramps, you have mood swings. So yes, so we have those things. But you know, to defend the boy child, they also
Yeah.
have a lot of things that go on for them. We know
Yeah.
that being you know, not to get political, but being a person of color here, a black man, they have a lot of challenges that they
No,
go through
definitely.
living in this
Definitely.
country. We do know that you know, people of color who you know, immigrants who come here, like Africans, you have a higher risk of getting sort of mental health schizophrenia type illnesses, men. So they also go through a lot of stress. I think that the differences in gender is how we express.
That's it. Yeah. And
How
what
we
is discussed.
express.
True.
Yeah, how we express what is happening internally. I think that is the big difference. So for
Yeah.
women, it's probably easier to spot, not so because we're women,
Yeah.
but for
right.
men, I think the way they express what they're going through is very different. So it might be very difficult
Yeah.
to
If they
see.
even express it,
Yeah,
you know?
if they express it, and you know,
Yeah.
our brothers,
Yeah.
our poor brothers are struggling. But again, it's from you know, from where we come from. Boys don't cry. Boys don't show
That's
weakness.
yeah.
Yes.
You
They
know,
have to man
Yeah.
up.
yeah, you have to man up, but you're depressed.
Yeah.
Take it off.
Yeah.
You know, they're
Yeah. Be a
expected to
man.
Yeah.
provide.
Be a man, you
Yeah,
know?
they expect. Yeah, be a man. Be a
Yeah.
man. You're
Be
expected to provide your. You know, so I
to
think
provide, yeah.
it's different. So probably men probably do have it just the same. It's just
They
they
don't
don't express it
express it.
the same way that that probably we do as women.
Okay.
Yeah.
That's that's good. That's I love that. I love that, you know, we're actually discussing some of these things. Because I suppose,
Yeah.
again, without discussing this, we would almost not know. You know, you can't force some people to say express themselves in a way that you would maybe understand what's going on. But sometimes having these conversations where maybe you're aware of the signs to look out for and things like that could
That's
help
right.
without necessarily you having to seek that, you know, that sort of direction from them. Like, okay, I need help. You know that you need to help them.
Yeah.
Just sort of talking around this, how can friends and, say, family support anyone experiencing seasonal depression? And what signs would we be aware of? So, as we said, men are not very good at discussing some of these things. So, say as women, I'm going to talk for myself here. So, as a woman, how would I be able to just sort of like help, you know, the people in my life, men in my life who might not be able to talk about these things, and what signs am I looking out for?
Yeah. So I think a really important thing is to be able to recognize the signs and symptoms. Yeah.
Yeah.
That is really, really important thing that probably in you know, as Africans, we're not very good at recognizing signs of mental illness.
Yeah.
So that's the first step, is being able to recognize. So you can help your friends and family if you can see that there's something wrong, because remember, sometimes when someone is depressed, they can't help themselves. So how, it might be difficult to come and ask for help, because they're so deep in a hole. So I think how to help is to be able to recognize that there's something wrong. And I mean, these are your loved ones, so you would know what their normal is. So in terms of when someone is depressed, so they're sleeping more.
Okay.
Their mood is low. So someone who's sleeping all the time, they're finding it really hard to get out of bed. So I know in an African context, they'll tell you, stop being lazy, get out of
Yes.
bed.
It's
Yes.
true.
So I think if you're with your partner, you would know him best. So if you feel like there's something not happening, and you should, and you know what is going on in his life, so it would be the best thing you can do is being there, offering emotional support, offering, don't judge, because also, it's really difficult to, I can imagine living with someone with depression. So, they used to be all this bubbly, you used to go out all the time. Now they're just at home. It's dramas. They don't want to go anywhere. You're not being intimate. It's just off. And the whole energy in the relationship is off. So I think it's easy to say, yeah, be supportive and and as women, not take it that there's something that you've done wrong. So I think being able to be there to support, to be his peace, right? Create an environment where, whether it's your partner, your brother, your cousin, your father, like, create that environment where they're able to come and say what's wrong, or you also going to ask, because sometimes we expect, as I said, people to tell us what's wrong, and they can't.
Yes.
Maybe they also don't know. They know something's wrong, but they don't really know what's going on, So also for you, to be your sister's keeper, your brother's keeper, you also check up on the people around you. Also, establishing routines, trying to do things that you enjoy doing together, things like that. And if it's very bad, my advice would be to seek medical attention. Get help for your loved one. So go to your GP, or come and see people like me, to get you the support that you need. It's really important. It's not, and I think also in our African communities, I don't know if we are suspicious of mental health, or professionals, or we don't like to come ask for help, or we see
almost like a sign of weakness, isn't it?
Yes.
You go to the doctor.
It's like a taboo.
Yes. So it's a sign of weakness for you to come and ask for help. Yeah. So what my advice would be, recognize the signs and symptoms of mental health. So it may not just be depression, it could be other things, and get help, and don't judge.
Yes.
And if it's happening to you, first of all, show yourself a little bit of compassion. I always tell my patients, show yourself some compassion. So if you're not feeling, you can't get out of bed, it's harder and harder getting out of bed. It's harder and harder doing the things you enjoy. It's not that you're lazy. It's not that you're failing. It's not that, it possibly is that you're depressed or low in mood, so cut yourself some slack, show yourself some compassion. And if you yourself are recognizing that there's something wrong, ask for help. And it's one thing to ask for help. It's another thing to accept the help that you're offered. This is
Yeah.
also very difficult. Yeah.
Yeah.
So that would be my advice. And also know that there are many ways to deal with it, as I said, because depression is multifactorial. So it's not just medication. There's other things because, there's something going on internally. So we can use
Yeah.
medicine to sort this out. But a lot of the factors are external. So there's no tablet for life. Yeah. And there's no medicine that we can give you that will help you sort out your life. So yes,
Yeah.
seek medical attention, go for counseling, some talk therapies, but also try and,
Yeah.
sort out or understand that sometimes lives.
Mm-hmm.
100%.
Yeah.
100%.
Yeah.
Yeah. Yeah.
Yeah. Yeah, I think that's been very, very helpful. Like, it's been very insightful, especially recognizing signs and symptoms. I think that's the main thing that I gathered from
Yeah.
this. And also like knowing each other and knowing what has been off. Like, once you recognize that no, this person is going through something. I think that is very important. As you said as well, sometimes in our homes it doesn't create that atmosphere where someone can actually express this thing that they're going through, which sometimes can play like a vital role in like these situations. So maybe I think people need to start looking at like the environment they're in, especially as Africans, let's put it that way. We need to create a good atmosphere for people to be able to express how they feel. Like, if they're going through something, they'll be able to go to one another and be like, oh, this is what's going on. Or maybe that person can recognize it. I think that was very important. Yeah. I've learned so much, but Doc, we wanted to also go through some myths out there where, like, people have put out there about these depression, seasonal depression, so that we can like clear that off.
I've heard a few things as well about sort of what people think about seasonal depression, and a lot of people say that only people in cold climates experience seasonal depression, but I've also read that it is more sort of prevalent in regions farther from the equator, and we know, like, so for me, I am from Kenya, right? The equator literally runs through Kenya, so like, what is your take on that? Like, how is that? First of all, is that myth? Even is that true? Like, what is your take on this?
So we know that it's seasons, right? So you can also there's a subset of people who get it in the summer. And because remember, it's light, so there are some countries, for example, that it's dark all the time in the winter, and then in the summer it's light the whole time. So you do have people who go through that. I guess there's not so much research, but just from deducing, us who come from the equator, our weather is temperate. We don't do extremes.
Okay.
Yeah, there's no extremes. We don't have extreme darkness, extreme light, extreme heat, extreme cold. So, our problems might be a little bit different. And we don't have seasons per se. Like the 4 distinct seasons. We have rain and no rain, basically. We don't have winter per
Summer,
se.
winter. Yes.
Yeah, we have rain, long rains and short rains. Yeah.
That's
it. So, I don't know. It's like comparing oranges and apples, if you know what I mean.
Yeah.
Because it's not necessarily seasonal. But as I said, even people in warmer climates, in hotter climates, they do suffer from the seasonal affective disorder. Because remember, if you're not being exposed to light, so if you're just staying indoors for long periods of time, and you're not going outside, you're not getting sunshine, your body clock is at a loop, you would suffer the same, because it's depression. At the end of the day, it's depression. It's just probably with the seasonal affective depression is one of the, a big trigger is the season that it's in.
Okay.
It's so I don't know if I've debunked the myth, but I think if we think of it as, it's depression. At the end of the day, it's depression.
It is.
Yeah.
It is.
And probably the season is just one of the many, many risk factors that would contribute.
Factors, yeah.
Yeah.
Okay.
So what would your take-home message be, Dr. Kamau, in regards to seasonal depression? What's the one thing that, if they've not listened to the whole podcast, what's the one thing that they should remember in regards to seasonal depression?
So the one thing many things, but the one thing I would like people to take home is that it is something that happens. So we know that seasonal affective disorder, or SAD, is a mental health condition, and we know that it's triggered by the changing of the seasons. So it's a subtype of depression. Okay. Also, and or bipolar disorder. And some of the signs and symptoms are prolonged sadness, general lack of interest, not wanting to do what you are doing anymore, sleeping too much, disruption in your sleep cycle, so yeah, the signs and symptoms of depression. If your symptoms are very, very bad, I would really, really, really encourage everyone to get help. So either you can go see your GP, or you can drop us an email at Elea Neuro. We are more than happy to help. We are a team of psychiatrists who are happy to help. You can try change your diet, or have a balanced diet, because as I said, you are what you eat. Exercise. So it's difficult to tell people to exercise when you're not feeling great. Yeah. I know it's it's difficult to tell you get out of bed. Get out of bed when you're, but for me personally, I try make it a thing to try and get a little bit of, do something you enjoy, move. So the recommendations is 150 minutes a week of moderate exercise. Remember, exercise can be dancing in your room. Yeah, just get your heart rate going up. It doesn't, it doesn't necessarily happen. It doesn't necessarily mean you have to be in the gym or running a marathon. It just means move, do the things you like, because when you do exercise, you produce happy hormones. Yeah.
Okay.
That make you feel better. So eat. So my take home message is, we need to understand and know what are the signs and symptoms of depression.
Yes.
We need to know that there's hope in that you can get help, there's treatment, so that you can go to a medical professional, or you can do some things by yourself at home to help yourself. So talk, balanced diet, exercise. So get a lamp, the SAD lamps. You can buy those online. And show yourself a little bit of compassion.
Yes.
And for us, we create let's create environments in our homes where we are able to express and acknowledge what people are going through. Yeah, so that would be my take home message.
Fantastic. Yeah. Thank you so much, Dr. Kamau. I think that was very helpful. I've learned so much, especially normalize this topic, trying to get us to talk about it. I think that's one thing I've learned about it, and recognizing the signs and symptoms. That's the key thing for me that I think I would take home. Yeah.
And I can leave our website. So we are called the Lia Neuro. We have a team of psychiatrists. We do general psychiatry, not just neuropsychiatry. And you can always drop us an email, and we're happy to help.
If you're going through any kind of depression, in this case, of course, we're talking today about seasonal depression, but at least if you're going through any kind of depression, you're not alone. There is hope, and there is a lot of steps and small steps towards sort of self-compassion, as Dr. Gathoni has constantly mentioned throughout the episode, is very important. And just seek support. And if you can't seek support, maybe talk to someone about what is going on, because this can make a significant difference in your mental well-being, especially during some of these challenging seasons. So always, also, as we have also learned from this episode, is watch out for the signs. For, people around you, there will be signs and things like that. And this way, that's one of the ways you can help them to even seek support, and just find the light within the darkness. Because that's what we always talk about depression. It's like you find yourself in the darkness and in a hole that you can't come out of. So just try find that light within that darkness. Because we all know that every small step in a lot of things when it comes to your health will sort of be that step towards self-care. Because there is always going to be brighter days. It's not always going to stay dark. It's not always going to be low. There will be brighter days. Dr. Gathoni is very passionate about social prescribing, and that means the modifiable factors in your life, like exercise, diet. Look into some of these things, because they could be the factors that are contributing to maybe you finding hard to get out of some of these situations and things like that. So little steps like that is very, very important. What is your take on message, Stephanie?
I think you've all just hit it right there on the nail. It was important to learn about what seasonal affective depression is, actually what depression is in general, and the sort of signs and symptoms that you experience. My take home message basically is just to tell people that although there's not one thing that you can do, like one medication that you could take to help you cure your seasonal depression, you just need to look at your lifestyle, what is going on in your life, what can you do to actually minimize these things that's making you feel low. Find that one person or someone that you could talk to, because I think it's quite important. Sometimes people like to just take in whatever they're going through and not burden that onto someone else. So if you're going through something, find that one person you could talk to about it, and hopefully they can help you recognize that, no, you're going through this, you need to seek more help. I think that's really important. Also, as we all mentioned, creating that environment amongst each other so that people can feel comfortable to talk to you. And one thing Dr. Gathoni said is actually show compassion unto yourself. I think people put so much pressure on themselves, or they have that misconception that, having seasonal depression, it's like a taboo sort of illness, and they tend to keep it to themselves. But show yourself some compassion and make sure that don't feel bad about it. Don't feel bad about it. It is something that is common, that most people are going through it. So it's something that people need to normalize. Seasonal depression is nothing to be, hiding or anything. Yeah, because people just need to feel free and talk about these things. And I think one thing that Dr. Kamau also said is that men tend to not be more open about their feelings. So as women or maybe family members, we need to be able to also recognize those symptoms in men, and also create that environment, as we've been saying, so that maybe the men can also express their feeling when they're going through such things. So my key thing is as I mentioned before, recognizing the signs and symptoms and seeking medical professionals when you need that help. Don't wait until it's too late. If you're getting those intrusive thoughts, please seek medical advice.
So we say, show yourself some compassion, and
Yes.
it's okay not to be okay.
Well, thank you so much, Dr. Kamau, for joining us. Hopefully, we all learned something and we could take home and hopefully impact on someone's life. Thank you very much.
Thank you so much for having me. I really enjoyed doing this, and as I said, I'm a fan. So continue doing the good work, and I'm always happy to come back to have more chats. So but thank you so much for giving me this opportunity to come and talk about mental health. Yeah.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week.